Excellency John Dramani Mahama, members of the diplomatic corps, country representatives of the health sector development partners, heads of agencies of the Ministry of Health, the chairman and members of the Medical Trust Fund Task Force, distinguished partners from the private sector, colleagues, members of parliament and ministers, our friends from the media, distinguished ladies and gentlemen, all protocols observed. Permit me to welcome you all to the official launch of the Ghana Medical Trust Fund, also known as the mahamacare initiative. This marks yet another groundbreaking intervention from the government of His Excellency John Dramani Mahama, reflecting his deep empathy for individuals grappling with burden of chronic non-communicable diseases in Ghana. You may recall that the establishment of the Ghana Medical Trust Fund was a key promise made by the then candidate, His Excellency John Dramani Mahama, and a central pillar of the National Democratic Congress Manifesto during the 2024 election. Today, we are gathered here to witness the fulfillment of this vital promise, a bold step towards greater equity and compassion in healthcare financing. The fund not only provides a long overdue lifeline to those burdened by chronic illness, but also positions Ghana as a leader in innovative, people-centered, and compassionate healthcare reform. Your Excellency, ladies and gentlemen, available estimates from the World Health Organization indicate that non-communicable diseases remain the leading global health challenge, responsible for 75% of non-pandemic related deaths worldwide in 2021. The WHO further reports that low and middle income countries continue to bear the heaviest burden, accounting for 73% of the NCD related deaths, primarily due to cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. In Ghana, the situation remains critical. NCDs account for approximately 43% of all-cause mortality, with a significant rise recorded between 2012 and 2023. Today, they rank among the top 10 causes of death. Alarmingly, individuals aged between 18 and 45, the most productive segment of our population, constitute over 50% of the NCD cases, impacting both public health and economic productivity. Facility-based data from our 3 teaching hospitals show that the average annual treatment cost for NCDs is approximately 53,000 Ghana cedis per patient. This financial burden severely strains households, with over 60% of affected families facing catastrophic health expenditures. Furthermore, individuals diagnosed with chronic diseases have a 75% likelihood of falling into poverty within 5 years. Those battling kidney and cardiovascular diseases in particular spend between 70 to 95% of their total non-food expenditure on healthcare, a clear indication of the devastating economic toll. Such a situation poses serious risks to public health and demands urgent attention. It must not be ignored. Swift and decisive action is crucial to mitigate its impact and safeguard the well-being of our communities. The Ghana Medical Trust Fund, the mahamacare initiative, offers a transformative opportunity to protect lives, preserve dignity, and strengthen our health system. A recent survey involving over 3,300 Ghanaians reflected strong public endorsement of the fund. 79% of respondents deemed it necessary, and more than half expressed willingness to contribute monthly. The overall objective of the fund is to mobilize resources to finance and support the treatment of non-communicable diseases. It focuses on covering the cost of treating chronic conditions, including cancers, diabetes, hypertension-related complications, cardiology issues, chronic kidney failure, and stroke at the specialist level. Support will be selective, targeting the gaps not currently covered by the National Health Insurance. In addition, capacity building initiatives are being pursued to expand access to specialist care with a strong emphasis on early screening and diagnosis. As a ministry, we reaffirm our unwavering commitment to achieving universal health coverage for the people of Ghana. The Ghana Medical Trust Fund aligns strategically with our key sectorial policy frameworks, including the National Health Policy 2020, Ghana's Roadmap for Attaining Universal Health Coverage 2020 to 2023, 2020 to 2030, the Essential Health Services Package 2022 to 2030, and the National Policy on Non-Communicable Disease 2022. We pledge to ensure the full implementation of this visionary initiative, enabling the people of Ghana to reap its maximum benefits under the inspiring leadership of His Excellency John Dramani Mahama. Your Excellency, ladies and gentlemen, today also marks the achievement of 3 major milestones in the establishment of the Ghana Medical Trust Fund. First and foremost, the task force inaugurated to guide this process has successfully completed a comprehensive policy document detailing the operational and management framework of the fund. Secondly, the draft bill for the establishment of the mahamacare fund is now ready and will be submitted to Parliament immediately after the recess. Most importantly, that's the primary obstacle. The capping of the National Health Insurance Fund has been removed. This significant development has unlocked substantial resources, ensuring that a dedicated allocation of funds will now support the full-scale operation of the mahamacare fund. These developments demonstrate our seriousness of purpose and commitment to the health and well-being of the Ghanaian people. As Minister for Health, I take this opportunity to call on all heads of agencies under my ministry, along with all collaborating institutions whose mandates are critical to the successful implementation of the Ghana Medical Trust Fund, to offer their full support and collaborate closely with the Ministry of Health. Together, we can ensure the successful realization of this transformative, life-changing initiative. Ladies and gentlemen, as I conclude, allow me to express my heartfelt gratitude to His Excellency John Dramani Mahama for entrusting me with the honor of facilitating the design and implementation of this groundbreaking health initiative. I remain optimistic that the people of Ghana, and indeed future generations, will cherish and appreciate the immense impact of this remarkable legacy. I also wish to express my sincere gratitude to the task force under the distinguished chairmanship of Reverend Professor Emeritus Seth Aite, and to all the technical experts whose invaluable expertise made the design of this sustainable trust fund possible. Further appreciation goes to the drafters of the bill and the dedicated staff of my ministry who worked tirelessly towards the realization of this visionary project. Finally, I extend my deepest thanks to the many Ghanaians who voluntarily participated in the national survey and expressed their unwavering support for this life-changing initiative. Your voices have been instrumental, and I assure you that we remain fully committed to serving you with dedication, placing your needs at the very heart of our efforts. On this note, I leave you with these words, and I quote, "When we invest in NCD financing today, we ensure a healthier and wealthier tomorrow."
Thanks for watching. Please like, subscribe,
and click on the bell for more updates.